Hi, I'm Tommy Whitelaw, National Lead for Caring and Outreach at the Health and Social Care Alliance Scotland. And thanks for tuning in to the latest episode of our Alliance Live series, Alliance Live 5, asking health and social care colleagues across Scotland 5 key questions. I'm very pleased to be joined today by a good friend, Andy Gillies, Spiritual Care and Staff Care Lead at NHS Ayrshire and Arran. Andy, can I start by asking how you're doing today?
Well, Tommy, I would be doing a disservice to say that I'm doing great. I'm tired, and I'm conscious of just that kind of the weight and the weariness that these last couple of years is meant for me and my colleagues. But as I was saying to you earlier on, in the middle of that, I'm hopeful. Like there's a wee chink of sunlight coming through my curtain right now, and I'm lucky that I've got somewhere that light can get in, and that wee bit of light gives me hope.
Well, I'm with you on that because I'm looking out my window just now and I can see some blue skies and the clouds are breaking up, and it's bringing a wee smile to my heart today as well. And if it continues, I might even hang a washing out. We're going to talk today about your role within the NHS Ayrshire and Arran and why taking the time to listen to people's spiritual and emotional needs is so important within health and social care, Andy. To begin, can you tell us a little bit more about spiritual care and what your role entails?
Yeah, so my role in Ayrshire and Arran has got three dimensions to it. One is to promote person-centred care at that within the organisation, within individuals, and for us to reflect on what difference does it actually make when we put people at the centre of their care. And we don't think about purely what we do to people, but how we are with them. So that's one part of my role. Another part, staff care, and that's really the services of compassionate listening for staff who give a huge amount of themselves to care for other people, sometimes to their own detriment. And so I oversee the team that provides support to staff in that way. And then spiritual care, and that's, it's quite a holistic thing in Scotland. In NHS Scotland, we talk about it can be one-to-one or it can be a group form of attending to whatever it is that gives you a sense of peace, hope, security, connectedness. And actually, well, not just in the middle of a pandemic, at any time those things are important. So I'll look after the healthcare chaplains who deliver that service for patients, their family, for staff. And one of I suppose, like a signature of spiritual care is helping people reconnect to the deeper part of themselves, the bit of them that says, this is why I do that job, or this is why this stuff matters to me. And helping, I think Michael Patterson, who's a pastoral supervisor in Scotland, talks about joining the dots between what you're doing and the why you do it. And I really love that image.
Well, that's lovely. And I think in this fast-paced digital world we're living in at the moment, keeping people connected feels even more important as well, that human connection. So thank you for that. Can I ask you, Andy, what brought you into this work?
I wanted to be a policeman or a police officer, and I studied criminology and psychology and sociology, and then ended up working in a gym, and then I became a personal trainer, and then a conditioning coach for professional football teams, and then managed fitness centres. And it was always with the view of eventually joining the police, but I really liked it, and I liked helping people's bodies, and it was always about getting a faster 10k time, losing a wee bit of body fat, or improving the vertical jump height that a footballer can get for a header. And I loved all that. And I loved that my job was running about, lifting weights and being fit. So it was great. But I just remember there being a lady who was exercising every day, first thing in the morning for a couple of hours. And I said to her, why do you do that? Every single day I see it in here. And the gym was downstairs and it was all dingy and dark. And then she said, I just don't want my partner to be disgusted by how I look, And I just, it went like a dagger straight to my heart, because I just thought, it was the first time anyone had honestly told me that they had a really savagely low view of themselves, and that they were willing to spend, about 10 hours a week beating themselves up downstairs to make somebody else think more of them. And I couldn't let it go, and I had a faith experience which kind of led me into the world of community pastoral care and all that, and ended up as a healthcare chaplain in the Southern General. And it's just like, couldn't have been a better place, because there was maternity wards, there was medicine for the elderly, there was respiratory wards and intensive cares, and it was just a place where you met all aspects of human need, and all like wee mini versions of that story. Like, people, what was it that made people tick, and what was it that really mattered to them? So that was how I got into it.
And in this quite very varied journey you've just shared through to this current role, what have you learned? Share something that you've learned with us, Andy.
Sure, I've learned such a huge amount. I've trained as a psychotherapist, I've trained as a chaplain, in that time as a reflective practitioner and as a pastoral supervisor. But see, I mean, really, behind it all, I suppose I've learned to trust that trusting your gut matters. There's a risk to move from one field of work to another. And the number of people who I would ask them, why did you come into this job? And they would say, I don't know, I just felt like this was the right one to do, or I was inspired by somebody that looked after my relative and I wanted to become a nurse too. So it's people who've trusted their gut always seem to be most connected to joy. And when I've heard it said that you've got 9 times more signals coming from your body to your brain than from your brain to your body. And so I think there's wisdom in that.
You mentioned inspires there. Actually, what inspires you in this role? What keeps Andy? What keeps Andy going?
Do you know? So I do feel the weight of stuff just now, but I'm okay with that. I know that to truly care is costly. So I'm absolutely okay with that. But like somebody said to me today, you fancy coming for a walk, and it was the rain was. What is it? It was horizontal, the rain, and I thought, no chance. And they said, just a wee walk and we'll catch up. And they had seen that I'd said, I'm feeling the weight of it. We went out for a walk, and just at the end of the walk, the sun came splitting through the sky. It actually got so warm, this could be a taps off occasion. And actually it was, that was another human being reaching out and connecting. And although my role right now is quite a strategic role, I do have the gift and the privilege of getting to be in these precious moments where I see people in hugely dark places bringing huge amounts of light to others. And I see hugely brave people carrying on with immense baggage. And I see that all of that comes from love. That there's something about that. It's almost a posture. My posture naturally tends to cave in and be like, oh, and it's that open-hearted sort of that tall posture of I care and I'm going to show up to this situation. That inspires me immensely. And I could change role and could have gone into corporate banking or carried on in health and fitness or in professional football world. And I just wonder how much satisfaction there would have been in that, and how much real human, like how many real relationships would I have formed there. That's what keeps me going.
Well, I'm glad you did take this direction, Andy, because I'm grateful to know you and grateful for the compassion and kindness and listening that you share with so many people. So I'm glad that's the direction that you've taken. Can I ask you, Andy, what do you hope for the future? What do you hope for?
Yeah, well, more sun, but not so much sunshine, that it's like global warming. So that's actually a great example of what I hope for. I hope that we can, that there could be that multi-level appreciation of things like the earth that we're on, the ground that we're connected to, the appreciation of each other. Follow them on Twitter, this person called Susan David, and she talks about, emotional granularity, that you can put word on, you can actually name and differentiate between your emotions. I would just love for Scotland to be a place that's known for us being able to say, I'm willing to hear your experience. I'm willing to tell you that I care about it. So that's that listening, and it's been able to listen and help people discern what's actually going on for them, so that the citizens of Scotland actually feel connected to one another, to the earth that they walk on. And then I think just naturally health comes from that. I think there's a huge poverty of disconnection, and my hope is that we find ways to keep on building that.
Well, thank you so much, Andy. And maybe if you ever fancy a walk in horizontal rain, come through to Glasgow one day. That sounds like most days here, and I'd be happy to have a wee walk in horizontal rain. So thank you for taking the time to talk to us today. Just as a wee closing message from yourself, do you have a wee message for colleagues across Scotland today?
I was in the extreme intensive care ward in Crosshouse Hospital yesterday, and I left a note that said, there's no act of care, time or attention that you're giving to people that ever goes to waste. And I'd say to everybody in health and social care in Scotland, and everybody who's caring for people, that there's not a single minute of your time, care or attention that you give to people that ever goes to waste. Never.
Well, that's such a beautiful message to finish on. Thank you, Andy. And thanks for everyone for listening in today. There'll be more information on some of the work Andy's doing in the outro slide at the end. So once again, thank you, Andy, for joining us. Thanks to everyone for listening and watching the latest Alliance Live 5. Please take care. Thank you.